Hey guys, so this is my next blog update. I haven't done one in a little while due to being back in hospital again for neutropenic blood count, which was awful. Basically what happened is I'm on Taxotere, which is quite a strong drug for me personally, and my 5th cycle I had it, and then after a week, which was exactly what happened last time, I suddenly felt ill. I felt freezing, and my temperature went above 38 degrees Celsius, which is obviously the warning sign of an infection. So I went to the hospital. I spent a whole day there waiting for my bloods to be tested, etc. And the blood count came back as 0.1, which is rock bottom, which is lowest. You have no white blood cells, you have no fight against any infection. So obviously I was placed in hospital again, and placed in my little room that I'm not allowed to go out of. And this time, because it was so low, I had intravenous antibiotics for 5 days this time instead of 4. On the 4th day, my bloods came up to around 1, but they wanted to keep me in for another night to get it a bit above 1. And by day 5, the blood test was finally taken and it was 2.2, so I was allowed to go home. I mean, obviously it's really hard being put in this room for 5 days, and the frustration of feeling well in yourself but knowing that you're waiting for your bloods to go up, you can't do anything about it. So finally, after the 5th day, I was allowed to go back to my nan and granddad's, where they're doing an excellent job of looking after me, much better than possibly the hospital would, but you know, we have to be patient. So I'm back here in my nice clean surroundings with my nice meals and being looked after well. So to try and tackle this, you know, reoccurrence on this drug Taxotere of this neutropenic blood count, my oncologist suggested in my meeting last Wednesday that I have 5 immune system and booster injections rather than just 2, because obviously 2 aren't doing their job. So I'm going to have 5 injections starting from Monday to Friday, that's next week, after my last chemo session, woo, big graduation, on this Friday, which I'm very excited about. So I'd love to celebrate my graduation by not being put in hospital again. So hopefully these 5 injections are going to do the trick, teamed with me being super careful about where I go, who I mix with, basically, you know, staying in the house for the danger week. So also I wanted to speak to you about my really important appointment with my oncologist, which happened last Wednesday. I met with the top oncologist woman, who's usually super busy, but she wanted to talk to me because I have surgery coming up next, and that's the 2nd stage of my treatment plan. And we wanted to discuss surgery options because I will need radiotherapy. That was confirmed. Radiotherapy is going to be essential for me because I have lymph node involvement, and we need to concentrate on that area, make sure the skin, the chest, all things like that are all rid of the nasty cancer cells. Now, she spoke to me about what type of surgery, and obviously my opinion comes into it, but she did state that she thought a bilateral masectomy, which is the removal of both breasts with reconstruction, would be an unnecessary amount of pain and, you know, work, whereas the removal of the right breast, which is the one with the tumour inside, would be something that would be acceptable. It would be understandable, you know, for me, feelings of anxiety, of reoccurrence, and feeling that this breast is probably, you know, a bit of a goner now, to be honest. You know, I'm only 21 and it's happened to me. There's got to be a reason. So I think for me, my heart feels like I should do that, and I wouldn't be able to have immediate reconstruction because I need the radiotherapy, and it would affect the implant. So I have to have delayed reconstruction, which would be about 6 months after the initial operation, which is going to be difficult. I mean, I'm 21, you know, to just have one breast for a while, it's obviously has its psychological effects as well, but for me, I need to concentrate on, you know, my main goal, which is being a breast cancer survivor, and if it means I have to have one breast for a while, then it's just you know, tough luck. It's just what I've got to do. You know, they have amazing prosthetics nowadays. People wouldn't notice, you know, I wear certain clothes, you know, even what I'm wearing now is like a slouchy jumper, things like that, you know, comfortable clothes. You know, things can be done. Oh, my dad's ringing me now. Call him back. Yeah, so that's looking like that's going to happen. But after my last chemo, they're going to do another MRI scan and an ultrasound to get a clear picture of what's going on with the tumour. Who knows, they might be able to just do a lumpectomy where they just take the lump out. But like I say, my heart's feeling like I should remove the danger breast, as I'll call it from now on. And, you know, start my life again without fear of recurrence there. So I think that's everything for now. I'm feeling good now. My eyelashes, on another note, are starting to dwindle, which is common on Taxotere, which is the drug that sort of is a bit more heavy on hair. But strangely enough, the hair on my head seems to be making a premature comeback. Obviously not properly, it's baby hair and it's not full coverage or anything, but there are hairs, quite a few of them, peeking through. So that bodes well for when after I've finished my last chemo. My hair should come back with a vengeance, so I'm really looking forward to that. And you know, stay positive, stay strong. That's all for now. Thank you.